I'm a health science and disability news nerd, and these were some stories that caught my attention this week. CDC has instructed its scientists to retract or pause the publication of research being considered by any medical or scientific journal that contains forbidden terms. This is a list of those forbidden terms that was emailed around: gender, transgender, pregnant person, pregnant people, LGBT, transsexual, and many more. The CDC says is not allowed to be mentioned in research. That's a problem. It's a big problem. Doctors for America is pushing back against President Trump over his decision to remove public health data from government websites that healthcare experts use every day. They are suing, stating that the removal creates a dangerous gap in scientific data available to monitor and respond to disease outbreaks. Vagus nerve stimulation may tame autoimmune diseases. A company called Setpoint Medical is trying to get the FDA to approve an implantable vagus nerve stimulator that they hope will lessen autoimmune disease symptoms. Very interesting, definitely something to keep track of. And lastly, because there's been so much terrible news, I found this story. Dogs in the UK are first to be trained to sniff out bowel cancer after nailing Parkinson's and COVID. So they're training the dogs by taking really tiny amounts of urine from people that have bowel cancer and putting them into situations like this, and training the dogs that when they smell the cancer and they can detect it, they give them treats and belly rubs and lots of love. And so the dogs eventually understand that when they smell that smell, they're going to get something good, and therefore they will alert for it, which is fantastic. It would be great to have more ways to be able to make easy diagnosis without any sort of invasive things. So good job, dogs.